Hi, my name is Joni. I'm a PA student from Jefferson.
I'm Heather. Nice to meet you.
Nice to meet you, Heather. So, what's going on? Why are we here today?
You know, I've actually been experiencing a painful red rash in my lower right ankle. Excuse me, ankle.
Okay.
Like right over here.
Okay. All right. On your right ankle, right? Okay. So, did it come on slowly or did it come on really quick? Did it just show up?
It just showed up.
Okay, just showed up. What were you doing, like, when this happened?
You know, I was just at home watching TV, and next thing you know, I just noticed it.
Okay. Is there anything that makes it worse?
No, not really.
No? Okay. Anything that makes it better?
Well, I find if I lift my leg up on the couch, it makes it feel a little better.
Okay.
The pain isn't so bad.
All right. Has anything changed from when it showed up?
No.
It's been the same?
Yeah.
Did you experience any other symptoms with it?
Actually, yeah, I've been experiencing, I feel like I have a fever, too.
Fever, okay. All right. Is this the first time you've ever experienced something like this?
Yes.
Okay. How would you describe how it feels?
I would say it's throbbing and itchy.
Throbbing and itching.
Mm-hmm.
Okay. Is it just in that one spot, or does it move to other parts of the body?
I feel it's just in that spot.
Just in that spot. Okay. On a scale of 1 to 10, 10 being like the worst pain you've ever felt, what would you rate it?
A 5.
A 5, okay. All right. And you say it's on your right ankle.
Yes.
Okay. Does the time of day affect it, or
No,
the time of year? It's just random? Okay. All right, so for your fever, when does that happen usually?
That happened at the same time I got the rash on my ankle, which is 3 days ago.
Okay. Was it in the same setting as the rash as well? Were you just watching TV at home?
Yeah.
Okay. Does anything make the fever worse?
No.
Okay. Anything make it better?
No.
Nothing makes it better? Okay. All right, so has the fever gotten worse since it started, or has anything changed?
I would say it's been about the same.
It's been about the same? Okay. All right. And would you say that the fever, it just makes you tired, or
Yeah.
just a little bit of tiredness and stuff? Okay. All right. And is there any time that it's, like, does it come on at any certain time of the day, or
No.
it's just all day,
Oh,
the fever?
Yeah.
All day fever. Okay. All right, great. All right. Are you taking any medications?
No, I've just been drinking hot tea with honey.
Okay. Tea with honey. Do you have any allergies?
No.
No allergies. Okay. All right. Now I'm going to ask a little bit about your past medical history.
Sure.
We'll start with when you were a kid.
Okay.
Did you ever have measles?
No.
Mumps?
Nope.
Chickenpox?
Yes.
You did have chickenpox?
Mm-hmm.
Okay. How old were you when you had those?
Chickenpox, I was probably 6 years old.
Okay, 6 years old. All right. And were there any complications?
No.
No? Okay. Rheumatic fever?
No.
Scarlet fever? Polio?
No.
Any psychiatric disorders?
No.
Okay. Have you received vaccines for polio?
Yes.
MMR? Or
Yes.
measles, mumps, rubella? Okay. Did you get your flu vaccine?
Yes.
Okay. Tetanus?
Yeah.
All right. Diphtheria,
Yes.
pertussis.
Yes.
All right. Rotavirus,
Yes.
hepatitis B.
Yeah.
All right. Did you get your chickenpox vaccine?
Yeah.
Okay. And pneumococcal.
Yep.
All right. Awesome. Now we're going to move to any illnesses you might have had in your adulthood.
Okay.
Did you ever have thyroid disease?
No.
Heart disease?
No.
High blood pressure?
Yes.
Okay. Hyperlipidemia?
No.
Okay. Diabetes?
No.
COPD or asthma?
No.
Okay. Cancer?
No.
All right. HIV? Right. Hepatitis?
No.
Kidney disease? Okay. Or blood clots? No? Okay, awesome. All right. Have you ever experienced any accidents or injuries?
You know, when I was a kid, I remember I fell from my treehouse.
Okay. How old were
I
you when
ended up
that happened?
breaking my leg.
Oh, you broke your leg. Okay. About how long ago was that?
This was about 10 years ago.
10 years? And what leg was that?
It was the right leg.
Right leg? Okay. Did you go to the hospital?
No.
No? So, what did you do to treat it?
Sorry.
It's fine. Just keep going.
No, my mom. My mom. Sorry, I'm laughing because my mom, she just put a cast on. She's actually a doctor, so she casted my leg.
Okay. So, your mom.
So people always laugh at me when I tell them I broke my leg and I didn't go to the hospital. I know.
It's fine. Okay. So, did you have any surgeries in the past or no?
No.
Okay. No surgeries. All right. Do you have all of your immunizations, including influenza?
No.
No?
Yeah.
Oh, yeah. Okay. Hepatitis B?
Yes.
Okay. Your zoster?
Yeah.
And pneumococcal?
Yes.
Okay, great.
Sorry. Oh, I can't believe I just told you that.
It's fine. All right. Okay. So, when did you get your first period?
I got my first period when I was 16.
16. Okay. When was your most recent period?
My most recent period was August 20.
Okay. How many days did it last?
4 days.
4 days. And was the flow heavy, light, or medium?
Heavy.
All right. Have you gotten a pap smear?
Yes.
Okay. When did you get your last one?
It's been about a year.
About 1 year. Okay. Do you know the results of that smear? Were they normal or abnormal?
They were normal.
Normal? Great. Okay. Have you ever been pregnant before?
No.
No? Okay. Do you have a history of STIs?
No.
No? Okay. Are you on any type of birth control, or do you use condoms? What do you use for contraception measures?
I use condoms.
Condoms? Okay. All right. How many sexual partners have you had throughout your lifetime?
17.
17. Okay, great. Would you say, are they with men, women, or both?
Men.
Men? Okay. Right. Let's see what else we have here. All right, now we're just going to talk a little bit about your family. So, your grandparents, are they still alive?
So both my grandpas are dead,
Okay.
and I have 2 grandmas that are alive
Okay.
from both sides.
If you don't mind me asking, how did your grandparents pass away?
Heart problems, heart attack.
Okay. For both of them?
Yes.
Okay. And what were their ages?
So my grandfather on my mom's side was 80,
80. Okay.
and my grandfather from my dad's side was 85.
Okay. And how old are your grandparents? I mean, sorry, your grandmothers.
So my grandmother's one is 75 and the other one is 80 as well.
All right. How about your parents? Are they still alive?
Yes, both alive and well.
Okay. Alive and well. And how old are they?
My mom is 60 and my dad is 64.
Okay. Do you have any siblings?
I have one sister.
Okay. Does she have any health issues?
No.
Okay. How old is she?
She's 35.
35. Okay. Do you have any children?
No.
No. Great. Okay. So, do any of your family have symptoms such as headaches?
My mom gets them sometimes.
Okay. How about, does anybody have seizure disorder?
No.
Stroke? Anybody have stroke? No. Mental illness?
No.
Suicide?
No.
Substance abuse? Thyroid disease?
No.
Okay. Coronary artery disease?
No.
Hypertension?
My dad.
Hyperlipidemia?
No.
Okay. Diabetes?
Dad again.
Okay. All right. And asthma?
Actually, my grandmother has asthma.
Has asthma? Okay. Tuberculosis?
No.
Renal disease?
No.
Arthritis?
No.
Allergies? Cancer?
No.
Genetically transmitted diseases?
No.
Okay. All right. Now we're going to talk a little bit about your social life. Can you tell me where you're from?
Yes, I was born in Florida.
Florida? Where in Florida?
Orlando.
Orlando? Great. How would you describe your childhood? Would you
It was
it
good.
Good? Okay, good.
Fair.
What is the highest level of school you've ever completed?
I completed a high school diploma.
High school? Great. What do you do for work?
I am a rock star.
Rock star? Awesome.
Actually, no, I'm in a band. Sorry.
You're in, well, could be rock star.
One day I'll be a rock star.
Yeah, amazing. All right, so let's see. How about your home situation? Who do you live with?
I live with my husband.
Your husband? Okay. What kind of home do you live in?
I live in an apartment.
Apartment? Awesome. What type of, do you have any religious or spiritual beliefs?
Yes, I'm a Christian.
Christian, okay. Do you exercise?
Once every couple of weeks.
Okay.
Not as much.
Let's see. Do you smoke? When's the, how much would you say that you drink?
On occasion, like once every blue moon.
Okay. Do you use any drugs?
No.
Okay. And I ask all of my patients this: do you ever feel like you might be a victim of domestic violence?
No.
Okay. Alrighty. Great. Now, alright, so I'm just going to ask you a couple more questions.
Okay.
Do you feel like you have any recent weight changes?
No.
Great. Does your clothing fit more tightly or loosely?
No. Same.
Okay. Do you have any weakness?
No.
Fatigue?
No.
Okay. Fever? Great. Besides the fever that you already have, right?
Mhm.
Skin. Aside from your rash, do you have any lumps?
Not that I've noticed. No.
Okay. Sores.
No.
Itching.
No.
Dryness.
No.
Okay.
Actually, the sore. The only thing that itches is the sore. But other than that, I don't have any other itching.
Oh, okay. Great. Have you seen any changes in color in your skin?
No.
How about your hair or your nails? Have you seen any changes?
No.
Great. Any notice in changes in the color or the size of moles?
No.
No? Awesome. Okay. I think that wraps up our interview. Thank you so much for coming in.
Yeah. Thank you.
I'll see you next time.
Of course.